Welcome to the American Cancer Society Cancer Action Network and You, an interactive orientation for new staff personnel. Click anywhere to continue. Welcome. This 15-minute interactive training is an opportunity for you to learn much more about ACS-CAN, our mission, and your role in this important time in our organization. During this online module, you'll hear about our history, volunteer and staff structures, our events, and our policy priorities. Along the way, you'll see those yellow sticky notes in the upper right-hand corner. They include notes and tips that will help you to navigate your onboarding experience with ACS-CAN. We're eager to get started, so when you're ready, click Continue. Founded in 2001, ACS-CAN is a unique organization. As the leading advocate for public policies that are helping to defeat cancer, our organization, now your organization, ensures that cancer patients, survivors, and their families have a voice in public policy matters at all levels of government. As the American Cancer Society's advocacy affiliate, a 501c4 organization, we work to encourage elected officials and candidates to make cancer a top national priority. You'll learn more about ACS's status as a 501c3 organization and ACS-CAN's status as a 501c4 organization during your introductory legal training. As of January 1, 2013, ACS-CAN is a nationally integrated organization with all regions under the ACS-CAN name, brand, and management. This is a much anticipated step in the organization's evolution, and it's easy to see why. Just look at the map. The western, central, northern, and southern regions are making ACS-CAN's work a truly unified nationwide effort. Each region has a director who serves as the direct link between the regions and the national office, allowing ACS-CAN to support local, state, and national campaigns better than ever before. And what kind of campaigns, you might ask? We'll click next to learn more. ACS-CAN is working tirelessly to ensure a strong and sustained federal investment in cancer research, as well as pass and enforce strong smoke-free laws and higher tobacco taxes, measures proven to reduce tobacco use, the largest preventable cause of disease and premature death in the United States. We're also ensuring access to critically important screening programs, especially among the medically underserved populations, something we know is saving lives across the country. And because more than 300,000 people in the U.S. die from cancer each year because they lack access to affordable, adequate quality care and treatment, and millions of others are forced to skip life-saving care or spend their life savings to pay for it, ACS-CAN is committed to advocating for access to quality, affordable health care. Lastly, we're building a policy-based infrastructure to combat the modern-day obstacles to good nutrition and physical activity. After all, an estimated 1 out of every 3 cancer deaths in the United States is linked to excess body weight, poor nutrition, or physical inactivity. These policy priorities drive our work every day. We hope you'll feel proud to be part of such an important advocacy movement and an important organization like ACS-CAN. ACS-CAN is first and foremost a grassroots organization driven by our strong network of advocacy volunteers. But who are our volunteers, and where are they exactly? Well, our advocacy volunteers are in every congressional district in the country, which means we're in every state and the District of Columbia. We've carefully selected 50 state-based lead volunteers we call State Lead Ambassadors. These State Lead Ambassadors, or SLAs, coordinate statewide activities and help ensure their U.S. senators have a continuing relationship with our volunteers, our organization, and our message. We convene this group of 50 SLAs annually at a spring event we call SLA Summit. And with 435 members in the House of Representatives, ACS-CAN has 435 ACT Lead positions, important district-wide volunteer leadership living in their districts. ACT Leads recruit local volunteers, lead important grassroots work in their district, and work year-long to build a powerful local advocacy organization that members of Congress recognize as their connection to the cancer advocacy community. Over time, ACT Leads and their volunteers share their personal cancer stories to build lasting relationships with their members of Congress and their legislative staff, relationships that are key to the success of our mission. ACT Leads and SLAs all travel to Washington, D.C. for our annual Leadership Summit and Lobby Day, usually held in September. Together, SLAs and ACT Leads ensure that all 535 members of Congress have an ACS-CAN leadership volunteer contact who lives in their district to ensure the ACS-CAN messages reach their offices and that we are heard. It's worth mentioning that some states are also piloting a State Legislative District Ambassador, or SLDA program. appointing leadership volunteers to state legislators to build relationships and share our message as we do at the federal level. Texas is one such state piloting the SLDA program. Let's look at our annual events. The SLA Summit is a spring event that allows the senior volunteer leadership from each state to come together and work to build a strategic vision for the coming year, while being trained on the latest and greatest from our policy priorities experts. And as I mentioned earlier, both groups of volunteers, SLAs and ACT leads, represent their states and districts at our annual Leadership Summit and Lobby Day. This event is a powerful one, as it's not only a training and development opportunity for our volunteer leadership, but also an important citizen lobbying effort. Every person who attends Lobby Day dons a light blue ACS CAN polo shirt and walks to the Hill in a sea of blue for pre-scheduled meetings with their members of Congress. Both events are truly important to our mission and help to empower our nationwide network of volunteers to complete their critical advocacy work throughout the calendar year. As an ACS CAN employee, you can expect a lot. Local, state, and federal issue support from some of the foremost experts in their fields. Counsel and advice on grassroots and lobbying strategy and tactics. Professional development, including both skills and issues training, and camaraderie among colleagues you can trust and respect. Our national team is ready and available to support you and your advocacy efforts. Our state and local team has issue specialists and strategic guidance to help you be effective. The grassroots team is comprised of direct action organizing experts who will help you to show the power of your volunteers and hold decision makers accountable. The federal relations team includes federal lobbyists and support staff who will support you as you educate the federal branches of government and build persuasive arguments on our key issues. The policy team provides fact sheets, studies, and reports, the ammunition of your advocacy efforts. The training team organizes training opportunities for staff and volunteers alike. Our media advocacy team is where you can find support on everything from media templates to interview tips. The program integration team can assist with ensuring advocacy is a part of all American Cancer Society events and programs. Our operations team will help you with everything from onboarding to HR and payroll issues and beyond. Lastly, our legal team is here to help you navigate the rules that govern a 501c4 organization like ours. Now that you know what you can expect and who you can expect it from at ACS CAN National, let's just lay it out there. We have high hopes for you too. ACS CAN expects you to give your best effort and go the extra mile. Our organization demands high and unyielding ethical standards from all of us, all of the time. Because we're a volunteer-driven organization, ACS CAN expects you to respect our volunteers. And because we work best when we work together, it's critical for staff colleagues to enjoy that same respect. All right, time for a quick quiz, just to make sure that you recall where to go for the resources you'll need. Can you remember which national ACS CAN team you'd go to for human resources help? That's right, the operations team. Where might you turn for a legal review of your materials? That's good. You go to our legal team by emailing advocacy.legal.mailbox@cancer.org. How about if you had a question about a piece of state legislation? Bingo, the state and local team. And for grassroots advice? That was an easy one, sure, the grassroots team. Now that you know where to find the support you'll need, you're on your way. All right, you did it. Congratulations, you've completed your online orientation to the American Cancer Society Cancer Action Network. As you move forward in your career here, keep in mind the tips and resources we've shared with you. Together, we can help move this critical advocacy movement forward and save more lives from cancer. Good luck. God bless you.